Governor Jay Inslee has promised that Washington will become a safe haven for anyone in the country looking to get an abortion or access to reproductive health care. But is Washington truly ready to provide the safe haven that it's promising?
We do ultrasounds over here in lab work.
Mona Walia has been running her abortion clinic in Tacoma since 2019.
And then we have 2 exam rooms. And so these rooms are very simple. This is where we do our procedures.
As an independent clinic owner, that puts her in a very small club in Washington.
Washington State has 3 independent providers right now that go up to the Washington State legal limit for abortion care.
But in the 4 days since the U.S. Supreme Court overturned Roe v. Wade, Walia says she's already getting more calls from around the country.
We're now seeing patients from Louisiana calling from there, along with just Idaho and Montana have been really high.
And she expects to receive even more. According to the Guttmacher Institute, Washington State is expected to see an increase of 385% of out-of-state patients coming to Washington looking to get an abortion. Walia says she's up for the task and highlights how the majority of abortion procedures in the U.S. are performed in clinics like hers. But the problem is funding.
We, as independent providers, are the primary specialists in abortion procedures. The problem is we have a lack of resources because we're small. Between the 3 of us, is it realistic that we see a 385% increase? Likely not.
But Walia says there's hope. Governor Jay Inslee says he plans to authorize $1 million in state emergency funding to help people access abortion services. Walia says she appreciates the state's support, but is also calling on the whole community to pitch in so Washington can truly become a safe haven.
We just need people to step up and, donate for travel, donate for lodging, and, open up their homes, things like that, so that we can see everybody that comes to the state.
Now, Walia went on to say that currently her clinic serves around 60 patients, but says that with enough staff, space, and funding, she could serve even more patients. She went on to say that although the situation is unprecedented, she has no intentions of closing her clinic. From Tacoma, Lionel Donovan, King 5 News.